this will come with the regulation that is the Ministry of Health, the one who will take care or will be in charge of the regulation, because in the bill, they didn't describe what are the pathologies that qualify for being like a candidate of using medical cannabis. They talk about having a registry for Panama patients that they will be registered at in the medical cannabis program. But now we have to wait to see what the Ministry of Health will say about this. If they will limit to certain pathologies or if they will leave it open. Particularly, I think this should be subjected to the doctor's judgment. And by that, I know we're going to talk about this further. That is so important to educate doctors too, because we know medical cannabis is not one cure-all or a panacea or a miracle cure. It's a very important tool in a toolkit of every doctor. But as a physician or specialist, you need to follow steps in order to decide if you do use medical cannabis or not, because usually it's not a first-line treatment. So it will be very interesting and to see how the Ministry of Health will approach this. I hope they don't limit like they did, let's say, in the UK. They have limited certain pathologies, and they will be limited just to certain specialists to prescribe. So we are just very anxious to see what will be that the Ministry of Health will be putting in the regulations about this. But for me as a physician, and according to what I have seen in my clinical practice in Colombia, mostly I would say like the 50% of the patients we treat in Colombia in our clinics are patients with chronic pain. You can call chronic pain, it's just like a very big word. So you can talk about oncological pain, like patients with cancer that have pain, patients with non-oncological pain, like neuropathic pain, arthritis, fibromyalgia, and all other types of pain. But of course, we have a lot of patients with chronic pain in Panama. The other group, important group too, is patients with a refractory epilepsy. We have also the patients with the multiple sclerosis, specifically with spasticity, and we have the patients with the nausea and vomiting induced by chemotherapy. Those were the ones that we will say there is stronger scientific evidence. But there is other pathologies as anxiety, Parkinson's, and other that we've been finding that the evidence has been increasing day by day. So a doctor, the one who decides if the patient should be treated with medical cannabis or not. It's important to have guidelines and all these things. I'm waiting for the Ministry of Health to give us the regulation to know better what's going to be more the frame, the regulatory frame in this matter. But I hope that all the patients that need it can have safe access. That is the most important thing.